Have you ever felt restless, uneasy, or anxious for no clear reason? Maybe your heart races for no reason, your mind won't slow down, and sleep feels impossible. You think it's stress or just getting older. But what if I told you it might not be stress at all? What if the real problem is something much simpler, something your body is silently missing? Doctors are now discovering that a simple vitamin deficiency can mimic anxiety perfectly. And the scariest part? Most people suffer for months, even years, without realizing it. The vitamin I'm talking about is vitamin B12. If you're over 60, your body may not be absorbing enough, even if your diet looks healthy. Here's why. As we age, our stomach produces less acid. That acid is needed to absorb vitamin B12 from the food we eat, like eggs, fish, and dairy. Without enough B12, your nervous system begins to suffer, quietly, without making a sound. And the symptoms? They don't always look like a vitamin problem. Imagine this scenario. You're sitting at the kitchen table, and suddenly, your heart starts racing. Your mind spins with worries. Nothing seems to calm it. Your hands tingle, your focus slips, and fatigue drags you down. Sound familiar? Many seniors experience these exact symptoms, and doctors often say, it's just stress, or it's normal aging. But in reality, your brain and nerves are asking for help. Here's what B12 deficiency can feel like: sudden nervousness or unease, heart palpitations that come out of nowhere, trouble focusing, forgetfulness or brain fog, mood swings or irritability, tingling or numbness in hands and feet, fatigue that sleep won't fix. Many people waste months, even years, thinking it's anxiety or depression, when the real problem is a simple nutrient your body isn't getting enough of. Take Margaret, 67, for example. For over a year, she felt anxious every evening. Her sleep was restless, her energy low, and her mood unpredictable. She tried everything: yoga, meditation, even anti-anxiety medications. Nothing worked. Then one day, her doctor suggested a B12 test. Her levels were dangerously low. After a few weeks of B12 supplements and dietary changes, the anxiety melted away. The medications she thought she needed never touched again. Stories like Margaret's aren't rare. They're happening to seniors all over the country. Why B12 deficiency happens to seniors? So why does this happen so often? As we age, our stomach acid decreases. Without enough acid, your body can't absorb vitamin B12 from food. Even if your diet is full of eggs, fish, and fortified cereals, your body might still be running low. And the problem compounds over time, because as your nervous system struggles, your mind starts sending signals that feel exactly like anxiety. Imagine treating anxiety for months, taking medications, changing your daily habits, and still feeling restless, irritable, or exhausted. It's not because your problem is complicated, it's because it's being misunderstood. When your B12 is low, your body can't make enough red blood cells or properly support your nerves, and the symptoms can mimic anxiety, depression, and fatigue perfectly. If you recognize any of these symptoms, don't panic, but don't ignore them either. Ask your doctor to check your vitamin B12 levels. It's a simple blood test, and it could change your life. Low B12 is treatable, and the relief is often dramatic. If your levels are low, there are simple ways to improve them: B12-rich foods, eggs, fish, and dairy, fortified cereals, and plant-based milks, supplements. If your doctor recommends them, 12 injections in some cases, for better absorption. Even small improvements in your B12 can calm your nerves, sharpen your focus, and restore energy you thought was gone forever. Not every feeling of anxiety starts in the mind. Sometimes it starts in the body. Listen closely to what your body is telling you, because the real problem might be easier to fix than you think. The relief, the calm, the energy could be just a simple test away.